Hi, and welcome to the 5-Minute Check-In. I'm excited about today's topic. It's one of my favorites, which is antimicrobial stewardship. This conversation was prompted by a publication in JAMA that I was very impressed with. Also by the fact that we have, I think, one of the nation's thought leaders in this space, and that's Dr. Renuga Vivekanandan, who is the CMO for CommonSpirit in the Midwest and a professor at Creighton University and a thought leader in this field of stewardship. Renuga, thanks for joining us.
Well, thank you for having me today.
Well, before we jump into this article, which I think both of us were pretty excited about reading, tell us a little bit, how would you define antimicrobial stewardship? What is this?
It's a big word, but what it boils down to is giving right antibiotics at the right time for the right duration. So it's not policing, it's just making sure we're giving the right therapy for our patients. But
I like that. It's not policing. No, I like how you said that, because I think you guys get blamed with being the antibiotic police. So, but it's not. Yeah.
And what's amazing about this program is it really has patient safety, quality, reduces multi-drug resistant organisms, C. diff. As you know, if you get C. diff in the hospital, if you're over the age of 65, 50% mortality. So lots of benefits of having antimicrobial stewardship.
So it's not just, hey, don't give the antibiotic. It's like, hey, how about this more narrow spectrum antibiotic, and maybe don't give it for 10 days, give it for 5 days, and really kind of help folks navigate that a little bit. So not just, no, don't give it.
Exactly.
Yeah. So let's talk about the article. Tell us about the article. What did they do, and what did the authors discover?
Yeah, so before the article too, I want to kind of frame it that in 2017, antimicrobial stewardship became a mandatory program at CMS and Joint Commission. So all hospitals have it. So how we work is ID physician and ID pharmacist work together and monitor things, and we do prospective feedback. Every day we review and give physicians and APP feedback on how we could do things a little bit better. But what's amazing about the article is they took that concept and they added electronic medical records triggering order entry for the physicians or APP. So they're able to put in a risk stratification that if you're a lower risk, for example, for MRSA or Pseudomonas, less than 10%, then the computer will trigger and say, you don't need the vancomycin or zosyn. Can we do something narrower spectrum? And they did this for pneumonia. And they were able to show narrowing antibiotics within the first 3 of hospitalization, day of hospitalization, about 30% decrease in antibiotic use, which is fantastic.
And this was across a large group of hospitals.
Yes, 59 hospital, part of HCA health system. Each arm had 45,000 people, and it was a randomized clinical trial.
So very impressive trial, randomized, large sample size, big number reduction, 30%. So very impressive. And, how do you think about this why don't you tell us a little bit about what we're doing here at CommonSpirit and think a little bit about, what this might inform us about as we look forward.
CommonSpirit, we have been really robust with our antimicrobial stewardship program. We have a national committee with ID pharmacists, ID physician, lots of stakeholders. We meet monthly to teach, make policies and procedures. But I also want to highlight what we're doing in Midwest as well. We have one of the earliest programs we launched, tele antimicrobial stewardship, where ID pharmacists were amazing, working with ID physicians. We remotely monitor and help all of our hospitals in urban, critical access, rural hospitals, and have made a really significant impact. So you could do antimicrobial stewardship lots of different ways, and we have a robust program here and in CommonSpirit Health.
So, I think the program that you've launched, you've been obviously a thought leader here at CommonSpirit, but nationally talking about how to do this. I love the multidisciplinary nature of it, working with our pharmacy colleagues, our nursing colleagues, APPs, and also the fact that we can reach remote areas through this program. It's been just really impressive. Well, Renuga, thank you for joining us and discussing this, really, I think, state-of-the-art article on stewardship. And thanks for everything you do for CommonSpirit.
Well, thank you for having me.
Well, thanks for joining me, and I look forward to seeing you in 2 weeks at the next 5-Minute Check-In.